Welcome back to Life on Record. I am here with Althea Fordyce. We're going to talk all things nutrition, feeding, what to do in certain situations. She's an expert, even though she says she's not. So tell us a bit about you.
All right, I started life as a nurse, landed up getting into the pharmaceutical industry, then landed up getting bored. So went to do a few studying things. So I landed up doing an MBA, and then I've got an MSc in clinical pharmacology. And through the MSc in clinical pharmacology and the working in the pharmaceutical industry, I logged on and connected with the Prof of Pharmacology from Pretoria University. And it's with him that I started getting involved in, horse nutrition basically, and how the gut works, and basically how to sort of like fix horses with gut problems.
So nutrition, I think, is one of those topics that we sort of know about, but we never really know a lot about. And I think from the pharmacology point of view, it's not often considered. So what do you think are the golden rules towards feeding, the basic things that we should consider in basic nutrition, excluding the supplements?
Well, we all know, anybody that owns a horse knows that horses are trickle feeders. They need to feed 24/7, non-stop. The question is, does anybody ask why?
Why?
Right, exactly. Because unlike humans, who, when we're hungry and we eat, our stomachs produce acid. A horse produces acid 24/7. It never ever stops. And there is some kind of circadian rhythm that actually happens with horses, where during the day, the acidity drops or the alkalinity increases, and then overnight, horses become more acidic overnight. Their stomachs become more acidic. So they secrete acid 24/7. What stops them from getting problems is their saliva.
Okay.
When horses chew, horses' saliva has got bicarbonate in it, and bicarbonate is an alkaline. Therefore, it helps actually normalize the stomach. So if your horse is not eating 24/7, he's slushing acid around, and there are 4 different areas within the stomach. And some of those areas in the stomach are more sensitive to acid than others.
So is that why we see such a prevalence in ulcers?
That is one of the reasons we get ulcers. Obviously, the other reason is stress. I think over the years, when I started life in the pharmaceutical industry, I worked with ulcers. And that's where I sold Alsanic. Oh, just by the by, I tried to sell Alsanic to the vets in 1982. They laughed at me. But certainly things like cimetidine and Alsanic, and then obviously the newer drugs like omeprazole and the other one,
Esomeprazole.
Esomeprazole, have actually come out to actually reduce the acid. But I think that a lot of problems can be sorted out by looking at the natural side of things. And I don't mean homeopathy, okay? What is the horse, and what does the horse need? Feed for what the horse needs, because if the horse needs something, then you fix that, then the horse is fine. Look, it's not cut and dried. I mean, there's always a nutcase in the field that goes against absolutely everything. So
there's always one.
Always one.
So going back to sort of the basic of it, we obviously want our horses to be in good condition. And I'm going to say rule of thumb here, if they are in good condition, generally they look healthy, and one hopes that they are internally healthy, though that is not always the case. But what would constitute a good condition? Because often sort of I find it that if one's at a yard and let's say all the horses are slightly underweight, that is the perception of normal and how the horse looks. So, well, again, it's how long is a piece of string, but what constitutes a healthy looking horse as a baseline that an owner could walk out to the yard tomorrow, go, this horse looks a bit healthy, it looks a bit unhealthy. What would be sort of the signs that you could then perhaps investigate further?
Now that's a big one, you see, because my horses always tend to err marginally on the side of show condition.
Horse of the year is coming up.
Yeah, when your 21-year-old is kind of like peak to actually win Autumn Gold Cup.
There you go.
What can you say?
So positive.
My horses are always slightly just above hard condition. A horse like Goose, you know,
Yep.
Goose, he's never fat. He's always in hard condition. Even when he's got weight on him, he never shows an ounce of fat. He always has a slight, in the sun, you can always see a slight reflection of the ribs,
Yep.
but he's round and he's fat. But he's in hard condition. He doesn't carry an ounce of fat on him. My Landau,
It's a land earl.
it's a Landau. He is either thin or he's fat. He's
Yep.
never in between. He's never in hard condition. He's either a little too lean or he's just show condition. But horses that are shiny, okay? Horses that interest or peak. Look at your horse's eye. Your horse's eye is
Window to the soul.
Windows to the soul. But your horse's eye tells you so much about how the horse is actually feeling. Obviously, if you're looking at my bugbear is grass bellies. Horses do not need to have grass bellies.
Yeah.
Grass bellies are the first sign of mycotoxin poisoning.
That's really interesting, actually.
So, I've played around with equine balance and
Yeah.
whatever, and I've played around with a couple of warm bloods where we've actually measured around the 18th rib.
Okay.
We put the horse onto equine balance, and within 3 months, we've lost 2-3 inches on the belly. It's just just an out of interest sort of like play.
For those who don't know, mycotoxin poisoning or what is it? Like,
right.
Idiot's Guide to
Idiot's Guide to Mycotoxin Poisoning. We feed our horses grains. Okay, number one. Grains are, first of all, they are genetically modified. They've got 80% more histamine in them than organic grains. They have, because they're genetically modified, there's some sort of like mixture where you've got pesticides and fertilizers in that. Okay. Pesticides, fertilizers, ammonia, nitrates. Okay. So those are two things. So ammonia and nitrates. Put that one side. Then these grains are actually hilded. They're thrown in. They check to see that they're dry enough, but they go into a storage. They always some kind of heat, some kind of damp, and you start getting fungus forming.
Yeah.
Those fungi are mycotoxins.
Okay.
So when this goes through the process of them being milled and whatever, all the way along there, I think all feeds have got mycotoxins in them. Most of the feed producers, especially dogs, chickens, and I think most horse feeds as well, they put in a mycotoxin binder.
Okay.
But it's a mycotoxin binder. It's not a mycotoxin binder. Arose by any other name.
Yeah.
Those mycotoxins get into the system, they get into the gut, and they proliferate. So what do? They cause lactic acid forming bacteria, and as a result, as they call hindgut acidosis.
Yeah.
Hindgut acidosis is the be-all and end-all of health in the horse. Fix the hindgut, you fix the horse. So basically back to mycotoxin poisoning, we actually played around with that, and we managed to drop 2-3 inches off a couple of warm bloods' bellies.
So with the mycotoxin poisoning, obviously you've got the grass belly as a symptom of it, but what other symptoms would you potentially have of it? I mean, again,
colic.
Okay.
Discomfort, bucking, girthiness, all these kind of things all have an impact on how the horse's gut is feeling.
Okay.
So again, as I said, I haven't done any studies. I've done one study, but I haven't done any studies to really sort of that are publishable or clinically relevant. But I've played around with it.
Yeah.
Looking at the bellies. Everybody knows Apollo, Annalise Apollo. Annalise Apollo arrived here. He walked straight down like he looked like a pregnant mare. Within a year, if you looked at the horse straight down, there's no belly.
Yeah.
Well, there was no belly. Poor boy, rest in peace. But so all of my horses, if you look at them straight on, they don't look like pregnant mares.
Yeah.
So if you look at them like that, you've got the shoulders, but then they're all built like
tanks.
and the belly generally aligns with the horse. So when you go to tack up your horse, we know that especially thoroughbreds on the racetracks, they grab the girth and they snap it up and whatever. But a lot of those horses, we know that 97% of thoroughbreds all have ulcers.
Yeah.
Why? High carbohydrates, high stress, and not enough forage.
Yeah.
To be honest. So We've gone all the way around in the circle. So where were we? Mycotoxin
Yes.
poisoning. So sorting out your hindgut, getting rid of the mycotoxins, i.e. equals a healthy horse.
So would they display this behavior all the time? For example, the girthiness, the sensitivity, or would they more display it in higher stress environments? Would it alternate?
Well, the one study that I did do, we did 7 or 8 horses that we suspected hindgut acidosis. And what we then did was we tested the pH of the poop.
And I think that we've spoken about that, not obviously on camera, but that is just a really good way, I think, of testing your horse's gut health. And I know we spoke
Bingo,
about it,
yeah.
getting the strips.
If you want to test gut health properly, you have to be invasive. You've got to do a biopsy of the horse's hindgut by putting in a scope and all that kind of stuff. But a relative indicator of hindgut pH is literally just going to go and get a pH strip. You pick up fresh poop. It's got to be fresh. You literally stand there and grab it as
wait for it to come.
and then squeeze it, because most of the sorry,
Althea's got a leg injury here, so the leg doesn't bend. So
doesn't bend very well. Squeeze the poop, put the liquid on the strip, wait for the thing, dab it off, measure it. A horse's hindgut pH should be around 7.4. Most of the pH strips only go sort of like not 4, 5, 6, 7. You can actually get increments of it, but you're either going to measure 7 or 7.5, one of the two. So 5 horses that I did on this study, I had a warm blood mare that was really tricky. I was not comfortable walking into her stable. But she was behaviorally just naffy.
Yeah.
Typical red mare. She was just naffy. So, and her pH was 5.2.
Wow.
Okay, so we treated her. There was a very slow turnaround with this mare. I think we treated her for 3 or 4 months. Month 4, the vet student that was doing the study with me, he came to actually help. So I sent him into the stable.
Sacrificial.
And she was a different horse.
Yeah.
She was calm, she was relaxed, she was chilled out, you can only wait around so much for a horse to poop. So
yes.
he did a rectal. So, and the pH was 7.
Amazing.
So, the other horse I did was a thoroughbred mare that had severe surgery, and that was skinny, and the horse.
Yeah.
And we pulled her pH from also, I think she was a bit better. She was about 5.8, close to 6, but we brought her up to 7.5 within 3 months.
Wow.
So I'm just trying to think who the other horses were. The other one, interesting, was a draft cross cobby type horse that had been colicking for 2 years, nonstop. In fact, the owner actually sent me a graph of when this horse was actually colicking 2, 3, 4 times a month. This horse was colicking. So we treated her for hindgut acidosis as well. And I think the last communication I had with her was the fact that he hasn't colicked since.
Amazing.
So why? But each of these horses had individual issues. Stress, I think, is the one. The other one obviously was an operation and a really, really sick horse. The cob was food.
Yeah.
The cob was living on ote. And I tried to get them to change the horse from long stem grass onto short stem grass, but because it was a herd environment, they couldn't actually do that. But we reduced the amount of ote because it's got a very high sugar content, and reduced the amount of carbohydrate that the horse was actually getting, put the horse onto a balancer, and then a gut optimizer, and then she's never phoned me since to tell me the horse is actually colicked.
So talking about gut, I mean, obviously there's a range of supplements out there, and I think as an owner myself, it can be very confusing. You walk into the store and there's shelves of gut products, as an example. What are good active ingredients to look at? I mean, I've used the equine balance, and obviously I know the research on it, and there is a lot of research behind it. The product's really well tested, which is what I like. When I go shopping for anything, I Google, like even for my own human supplements, just as an example. I look at research papers and then, for example, the milligrams per kilogram you're supposed to have, because with some of these products, they sell you 10 milligrams sort of the product, and then you actually need 50. So that 10 is going to do nothing bar cost you money. And I think with the horse research, I know Dr. David Marlin in the UK does a lot of research on products, but what do you want to look for gut health as active ingredients? Because obviously it's got to get to the hind gut, and obviously I know from a human side you can take a probiotic and it's washed out by your stomach acid, so it does nothing useful for the rest of it.
Okay, there are probiotics that do get to the hind gut. Okay, so, and the one is, okay, so some probiotics, especially some of the yeasts, can get to the hind gut. Okay, but it doesn't mean that my yeast that does get to a hind gut, that your yeast is going to do the same.
Yeah.
Because it goes right back again. Where's the evidence? I am really, and with respect, I am tired of people's journeys about how a product helped their horse. Now it is going to help every single else horse. Give me a product that has got clinical evidence, that has been proven by research to show that it actually works.
Yeah.
Then I'm a pharmacologist by nature. So that's what I actually want. So yeah, some yeasts do get. Stop throwing bicarb at your horses. Okay, anything that's got bicarb on it is just going to dissipate within the gut. You do need acid.
Yeah.
You need acid in the gut to do an enzymatic breakdown on the food that the horse eats. And the better, honestly, the better the acid in the gut, the better the breakdown of your carbohydrates.
That makes sense.
Because it's the carbohydrates that get to the hind gut. That is another place where you get hind gut acidosis, is because the carbohydrates. Now you throw brewer's yeast in it. I'm not talking about some of the other yeasts, but you know, you just, the more you throw at your horse, the more problems you're actually going to get. So certainly zeolites, okay? And zeolites and diatomaceous earth, okay? There's zeolites, there's diatomaceous earth, and there's various different clays. These products are well tested by the parrots in the Amazon. Okay, look at the parrots in the Amazon. What do? They go to clay banks, they eat clay. That is basically, it's a clay, it's within the range of, diatomaceous earth is not a clay, equine balance or a zeolite is not a clay, but they're all on that scale where they've got proven effects to reduce hind gut acidosis. Most of them, what they do is they work on a cation-anion exchange. So they absorb the mycotoxin and the mycotoxin gets pooped out.
Okay.
So, but you've got to be very careful of using things, because my question to you is, can you prove to me that diatomaceous earth does not absorb your vitamins?
Yeah.
Okay. Humic acid, fulvic acid, can you prove to me that they do not absorb your vitamins? Well, the zeolites can. Zeolites can prove that they don't absorb vitamins. There's clinical evidence to actually prove that. There's evidence to prove that they get to the hind gut. We've proved it. And the products that are out there have been tested. So it does not mean that you're doing a disservice to your horse if you're actually feeding it humic or fulvic acid or diatomaceous earth, by no means. But look at the range of efficacy, look at the range, and look what it's actually doing for the horse. So I don't want to run down any product, but you know, there are ranges of efficacy and various different things there. So so if you're going to use a supplement for your horse, go and do your homework. Yeah. Go and read the literature. Don't listen to somebody's experience or their journey.
But Facebook is the Bible place for all things nutrition, and that's why you post anonymously.
Unfortunately, this is where we've got to.
Yeah.
We've got generations that are coming through that believe Facebook. Yeah. And, you know, that believe that TikTok is actually giving you the same benefits as research studies. Yeah. You know, cut through the crap. Sorry, you know, really cut through the crap. You know, look at things objectively, look at things that work, look at things that have been proven that they can actually work.
Yeah. So you mentioned a point, and I think you're one of the people who's got the most experience that I know on this in terms of short stem versus long stem grass. And what I want to touch on it as well is obviously you've had horses in that can only have short stem for varying reasons, colic, thickening in the gut, all of that. But I think it's also something to consider nowadays, particularly I think come the end of summer now, we're going to have a grass shortage. It's a reality. We had odd rains this year. I know personally my farmer who normally gets 4 cuts only had 2. So I think come November, December, January, depending on when our rains come this year, we're not going to have enough grass. So short stem is then an option for people to consider. And honestly, having looked at the horses in your care that have been on short stem, they've thrived.
They survived it magnificently.
So what is short stem versus long stem? Let's ask the dumb questions first for Siobhan.
Okay, obviously long stem is grass that is grown out in the veld that the farmer comes along and he shoves it into a bale. So that obviously includes any kind of mixed grasses, lucerne, teff, eragrostis,
oat hay, smutsfinger, and all of those.
And all of these things. These are all considered long stem. So it goes back to again is how does a horse break down their food? Okay. Carbohydrates are enzymatic digestion in the stomach, and they're supposed to be enzymatically digested, and then they go to the hindgut, and the volatile fatty acids get absorbed. Grass has got to get to the hindgut to be fermented.
Okay.
And it's the fermentation process that then gives you the volatile fatty acids. Well, again, a horse can only absorb long stem if the hindgut is correct.
Correct.
Okay, if the hindgut pH is correct. So, yeah.
So I think that's a really interesting point, that if there is a problem with the hindgut, it doesn't actually matter how much you throw at them food-wise.
Fix the hindgut.
It's not gonna be effective.
Okay. I just want to jump back to why I've got to know so much about short stem. Is how many horses do you know that have never colicked in their lives before, and they suddenly get to 20, 23, and all of a sudden...
I'm just finding a piece of wood there to touch. Okay. Knock on wood.
All right. I know of at least 7 or 8 horses in the last probably 6 or 7 years that have never colicked and then have suddenly colicked.
Yeah.
I've had my horse for 20 years. For 17 years, he had no issue. No issue. Okay. All of a sudden, he suddenly landed up with colic. Okay. So he was in honest to put for 3 months. I took him out. He wasn't in honest put for 3 months. Perfect. Took him out every single time he colicked. He suddenly recolicked again. They kept on refeeding him like they do. Long stem grass, soaked, wet, whatever, what else. Nothing worked. So I contacted a trusty vet in the UK who came back and said, low residue. Take away long stem grass. And I've never looked back since. Yeah. Okay. So that's the start of the reason. Yeah. So we know what long stem is. What is short stem? Well, you take the long stem, you hoe it through a mill, you put it into a cube, or you make it into chaff. That's short stem. Yeah. What else is short stem? Allowing your horse to graze. Okay. Okay. So,
and that unfortunately here is a problem in terms of paddocks. Not everyone has grazing, unfortunately.
I don't have good grazing at all. In some I have a little bit, which is great.
I'm just going to point out that Althea has very large paddocks that have grass, and I'm going to say they have grass in them to iterate the point that I think a lot of people think that, for example, I've got grass in my paddocks. They're all fairly big. They're 30 meters by 30 meters. So there's always grass, but it's not necessarily nutritionally viable
grass. Though the advantage is the horses are chewing all the time. Yeah. Therefore, the advantage is that the horses are trickle feeding all the time. Now, bearing in mind that I've now had 3 horses in the last year, well, other than my goose, which I've had now for a whole bunch of years. I mean, he's 28 this year, and he still looks like he's a 3-year-old wanting to gallop and buck and do stupid things. But plus that, I've now had another 2 horses here, plus I've helped about 3 or 4 horses. So short stem grass is basically just that. It's cubed grass. Okay, so feed cubed grass. Okay. Because the horse, it is as nutritious as long stem grass. It's actually probably more nutritious because it's got added vitamins. Well, you can get just pure grass. You can also get products that have got added vitamins and minerals into it. But as long as the horse if you're feeding a horse with short stem, as long as he's got enough grass to feed 24/7, you won't have a problem.
So what would you feed weight wise I mean, is there a difference? For example, most of mine eat, let's say, half a bale a day, half a bale to a bale, or 3/4 of a bale a day. What volume would you feed of the cube or the milled short stem? I mean, is there
8 kilos a day.
Okay.
So in other words, basically the same
Yeah.
amount of, now bearing in mind, if you take a half a bale of grass, you know, and you try and measure it, it's going to weigh nothing.
Yeah.
Whereas the cubes are concentrated. So I think, if I remember correctly, remember all my horses are big. So at average, my horses should be eating about 5 to 8 kilograms of grass a day.
Yep.
Plus then at average, the normal 2 to 3 kilograms of concentrate. But except for the fact that my horses don't eat any carbohydrate whatsoever.
Okay.
So all my feed is grass-based.
Okay.
And you've seen
Yeah.
you've seen some of the horses I've actually had here, and on absolutely zero carbohydrates. They're fat, they're round, they're wired,
Yeah.
they're feisty, and they're fit, and they're strong.
Yeah.
So you don't need to push carbohydrates down to a horse's gullet.
Yeah.
So in order to make sure that your horse has got food all the time, I feed 7 times a day. Yeah, but it's not that difficult.
No.
You know, you get up, you feed the horse breakfast like you do. Okay, horse goes up to the paddock, you take a bucket of food with you.
Yeah.
You wet that in the food, you leave it there. The minute the horses that go onto short stem grass feel that they're not hungry, they don't gobble their food.
Yeah.
They go and they eat and they leave, they go and graze a little bit, and exactly like they were doing if they've got a pile of teff in winter.
Yeah.
They go and they graze, and then they come back and they nibble on the teff, and then they go and nibble there. The horses on short stem do the same. All my horses get 3 meals a day, standard 3 meals a day. And then in the afternoons when my grass horses come in, they obviously have a pile of Eragrostis or teff so they can nibble on. So my horses on short stem then get a short stem meal.
Yeah.
And to really advertise this like a way, the be all and end all of feeding your horse short stem grass is a liquid snack ball.
Okay.
That has been my saving grace, and it's been the saving grace of every single person I've recommended it to. So when you go and you do your last barn check at night, you make sure that your grass horses have got grass. I give my non-grass horses a meal, and then I give them a liquid ball. So when I get onto my cameras at 10, 11, 12 at night, they're either sleeping
or they're playing with the ball.
they're knocking the ball around and they're taking out grass.
Yeah.
Taking out grass cubes. So, you know, I know we've gone off the track, but so it is seriously easy to maintain a short stem grass horse, be it either because there's a grass shortage or because you've got a horse with gastric problems or GI problems.
And you found that the short stem is being an effective solution because they are trickle feeding again.
The whole object of the exercise is make your horses trickle feed.
Yeah.
What do we do with horses that gorge their teff? We give them slow feeders, don't we?
Yeah.
Okay. So ball does exactly the same thing. There's your grass in your ball, trickle feed.
Yeah. I've got one that has a hay bar with a slow feeder net inside because otherwise he just throws it everywhere, stamps it into the ground, and then doesn't eat it.
Oh, my landau and packs his entire hay bar.
Yes.
And then he lies down, and then he sleeps, and then he sits up, and then nibbles, and then lies down, puts his head on his teff.
Yes.
What can I say? He's a landau.
Yeah, no. They do have that. So you found that's helped for the mycotoxins, and then the zeolite as well.
Look, I did all the workup on the zeolite called Equine Balance.
Yeah.
And the amount of information I found on the benefits of zeolites across the board is absolutely phenomenal. It is obviously that's the basis of zeolite. It is a mycotoxin binder.
Yeah.
Equine Balance in South Africa obviously has been developed by an engineer and the proper human pharmacology from Pretoria University, but it's been potentiated. So we have a horse. What do we feed? Now it's got to be like 50, 100 grams. I know there's a supplement out there that you're feeding 200 grams a day.
It's a lot.
Right. equine balance, you just pop a teaspoon in. You
Yeah.
literally pop 5 mils in. This actually shows the potentiation of it and how effective it actually is.
Yeah.
So, and that's what I still to this day actually feed. So, and I have no colics, I have no hindgut acidosis, I have healthy horses, and well, they tend to get aged.
So onto sort of long stem grass. Obviously, we've got options. I mean, up in Joburg, I think we are blessed that we can get Eragrostis, teff, oat hay. But obviously, when you're down in regions like the Cape, oat hay is what you get. You can get teff and era down there, but you're going to pay. And I think already in livery in the Cape regions, you are getting hit hard.
I mean, if you think of the cost of grass nowadays,
yeah,
I have not done a comparison. Okay,
it's terrifying. I think you're on average, and I'm going to say on average, and I'm sure some people can get cheaper and some paying more, but on average, you're looking at about 100 Rand for a square of Eragrostis. And that is normally slightly lighter weight depending on where you're buying. So let's call it for a 24 kilo bale of Eragrostis is 100 Rand. For a 20 kilo bale of teff, you're about at least 120.
Okay. I haven't done a comparison of long stem to cubed grass, but with the price of grass going up more and more and more, the benefits of using short stem really do come to the fore. Look, if I calculate out the cost of feed on my short stem horses, yes, they are more expensive than my long stem horses. Yep. But I've got horses that have got problems.
Yeah.
I've got a wonderful wildlife environment. So what my horses don't eat goes to the wildlife.
Yeah.
And if the wildlife doesn't eat it, it goes to the compost heap and it goes back into the ground.
Yeah.
So, but so I don't hold back cost to feed my horses. Bearing in mind that I have mainly my own horses here, and I have the odd livery that actually comes in. I don't hold back on that.
Yeah.
There's no such a thing as trying to ration out. If the horse is hungry, it gets more food.
Yeah.
If the horse is not hungry, it still gets the same amount of food because tomorrow it's going to be hungry. And it's going to eat that.
Yeah.
So, I would rather just, rotate it into recycling across the board to make sure the horse is actually getting what they want.
What is the challenge with your higher sugar grasses like oat hay? Sugar
is a carbohydrate. Carbohydrates cause acidosis, create hindgut, equal colic.
Yeah.
So I think that is probably the risk. But yeah, you know what? If you've got oat hay and you've got nothing else, soak it. Soak it. Get rid of the sugars.
And how long to soak it for? Because again, that's okay. Always the challenge.
It's not about running it through with water. It's about filling your hay net up, putting it in a bucket and letting it soak for 8 hours.
Okay.
You've got to get rid of the sugars. Or feed grass cubes.
Or feed grass cubes. And then one of my favorite grasses is lucerne. I love my lucerne. My horses love their lucerne. It makes me happy. Cuvette.
Lucerne makes me happy. I'm sure I feed lucerne to my horses because it makes me feel happy. Lucerne is phenomenal when actually reducing acid.
Yeah.
Okay. It's absolutely amazing when reducing acid. Put it in a cube.
Yeah. So, for example, when we're trucking, I generally fill most of my teff nets with lucerne for trucking because it makes the horse happy. It makes the horse happy. It makes me happy. My horse is cold. I put a blanket on it. I feel cold. It gets another one.
Exactly. I must admit. Look, we do that.
Yeah.
But lucerne is incredibly nutritious.
Yeah.
I mean, any horse that actually is recovering from any kind of trauma, especially gut trauma, lucerne.
Yeah.
Okay. Obviously with other milled grasses, but certainly lucerne is incredibly nutritious. And also, look, I'm not going to break down because I don't know the intricacies of the breakdown of the nutritional value of oat hay, Eragrostis, teff, and lucerne. I just like to feed when I can. My mainstay is Eragrostis. And for horses that I think need a little bit of extra nutrition, I will add in teff because it's got more protein into it. And I add lucerne because it smells lovely. I know it's incredibly nutritious. And when you get good lucerne, it is, you want to actually go and put your blankie in there and sleep with it.
No, it's amazing.
So, you know, so I do that. So at the moment, I don't have any teff because
it's not the easiest to get.
It's not the easiest to get hold of, and I only need it in small doses. So I feed lucerne cubes, and I feed basically. Am I allowed to call brand names? Yeah. I feed Epol.
Okay.
I swore blind I would never ever feed Epol from 20, 30 years ago. But I fed the Equus feeds, and obviously Epol took over Equus, and those foods are phenomenal. So my mainstay in this barn is Epol Nice and Easy. That's it. So when people feed grass, I feed Epol Nice and Easy.
Yeah.
If the horse is getting a little bit fat, I add on. I take a bit of Nice and Easy away. I add in essential roughage.
Yeah.
If my horse is fat, he doesn't get lucerne cubes. So, and then the other thing is because I'm adamant about hyangarasagosis, I feed fiber beet.
Yeah.
Fiber beet's got a bit of lucerne in it, and obviously beet pulp. I would feed speedy beet.
Yes, I was about to ask that on the speedy beet.
My queen, my princess, my metro horse, refuses to touch speedy beet. He will also not touch anything that's got a balancer in it.
Okay.
So no matter what balance you actually feed him, he'll look at you and say, go back and try again. So everything that I feed in my barn revolves around him.
Yeah.
So I don't want to mix speedy beet and fiber beet. So the other horses get fiber beet. And that's all. But speedy beet is amazing to reduce acidity and also reduces hyangaracidosis.
Okay.
So I start off with fiber beet, Epol, Nice and Easy, essential roughage.
And those are all sort of, I want to say, roughage based feeds.
I only feed roughage based feeds.
Yeah. I've got to think, I like my roughage based feeds because I can see the feed. I know it sounds weird, but milled food sometimes makes me a little bit nervous because you can't always see if the ingredients have changed. For me, with the roughage based stuff, you can look at it and really go, this is the same, or have they changed it? And I also, as a personal thing, find it quite useful for mixing in a supplement if I am supplementing, that it blends easier with a roughage base.
Yep.
So same.
Because I use the liquid balls, I always use a 6 ml lucerne cube.
Yeah.
And then also because I have liveries and because it's recommended by the vets, I'll also then feed Equifeeds high fiber cube.
Yeah.
But I do that, but my horses don't get the Equifeeds. It's just my liveries that land up getting Equifeeds because that's what's been recommended.
Then just in terms of, obviously, as we said, sort of onto supplements, electrolytes, yes, no, benefits, salts.
Okay, so this is a whole big thing because I went and I did some extra reading because I look at this and say, what the hell do you want to throw crap down your horse's food when it's not part of his natural environment? Yes, we boost our animals' feed because we compete. We want them to be sort of like nice and fat and round. We need them to have energy, but with grass-based feeds, I've not had one horse here that has been a slowpoke because they're not getting maize-based feeds.
Okay.
So again, why?
Yeah.
Okay. I'm not saying it's the right thing to do, but that's just my experience.
Yeah.
I mean, my Landhill bucks like a bronc, like seriously. Never mind my Namibian.
Yes.
When they've been in work, they are feisty. They are not,
they don't lack the energy.
They don't lack the energy. The livery I have at the moment, apparently before it got landed up having colic, it was a very level-based thoroughbred.
Do you get those?
It isn't anymore. So, that's why, because the horses getting a lot of lucerne and a lot of nutrients and not enough exercise. But then what I will do now is I'll change the ratio and drop the lucerne to actually pull back the energy a little bit.
Yeah.
And that's what I love about the food that I feed.
Yeah.
Is, you know, like if you see my feed board, 500 grams here, 250 grams there. I literally manage the food by changing it by 250 grams at a time.
Yeah.
And yeah, so, you know, I've got lots of colored bins and colored stickers. But as you've seen, but older horses, get them off long stem, put them on short stem. They do better. They don't have to chew, because we know older horses get teeth problems. My horse specifically, and I think most older horses, you talk about thickening of the small intestine.
Yeah.
My question is, why do they get thickening of the small intestine? Again, I'm not a vet. This is just my summation. Why do they get thickening of the small gut?
Carbohydrates and sugars.
And
the grass.
What happens when you body build? You build muscle.
Yeah.
Right. So what is happening when you're losing peristalsis in your small intestine, because now you're getting older? All have age-related changes. And with older horses, when they're not being able to chew the longer grass easier, what happens is that the small intestine has to overwork.
Okay.
So you get elements, and this is my horse, is elements where the small intestine peristalsis is moving properly, and you get other places where it's become hypomotile. So you've got areas in the intestine that need to overwork.
Okay.
Take away the long stem grass.
They don't.
Feed wet food. Okay. I do not feed dry food
Yep.
at all. Every single one of my horses gets very wet food. And the only time my short stem eat dry food is in the ball.
Yeah.
And if I'm a little worried that they're not drinking enough grass, salt, I'd put salt in the ball.
Yeah.
And yes, I think we need to feed salt to our horses all the time. But in a way, we shouldn't be force feeding our horses salt.
Okay.
Okay. Horses know when they need salt.
Yeah, I've met a couple of warm bloods that I don't think know much.
But I do feed salt.
Yep.
I do to put a spoonful of salt in my horse's feed every
Would you do
day.
a bit of extra in change of season, just to encourage a little more drinking, or change in weather? I mean, particularly up here in Joburg, I mean, we go from 0 to 24 in a day, you know, and I wonder about some of my horses' intelligence when it's 37 degrees in summer and they've got a lovely shaded area, they've got a tree, and it stands in the sun.
And it doesn't drink water.
Yes.
Yeah, no. Salt is your best electrolyte, really.
Okay.
So if I'm worried about, interestingly enough, I get more worried about temperature change from cold to hot than from hot to cold.
Okay.
I found that, especially the couple of horses that I've had that tend to, like Darko.
Yep.
I had Darko and Apollo. When they were two old horses, and bearing in mind Apollo was 25 and Darko was 27.
Yeah.
Okay. I found that the shift from cold to warm is where they would suddenly not drink enough and get and land up getting colicky. Just mild colic, nothing really major. Then I would add extra salt in there. Do I feed electrolytes? Sure, I've got a thing of electrolytes in my
in your feed room.
In my feed room, but it's there. And again, I think that electrolytes are better post exercise than pre-exercise. To actually for recovery, because you've burnt muscle, you've gone show jumping, you've done DSA and what else. And then I just give liquid electrolytes, or just a paste or gel, and bup it in. So
then oils. Again, this is also, I mean, there's a lot of anecdotal stuff about sunflower oil, canola oil, salmon oil. Are you needing omega-3s? Are you needing omega-6s? Again, they don't necessarily get oil in the wild, but oil is reputed to be allegedly that it's slow energy, if that makes any sense. I've had some horses do better on it. Again, this is anecdotal, my personal experience. That I think they do better on it. Let me rephrase that. I just got a side eye there. I think.
I feed oil.
Yay!
Okay. I feed oil. There's a better mix of omega-3s and 6s in canola oil than there is in sunflower oil.
Okay.
So my thugs, like my Namibian and my land earl, they don't need canola oil.
No.
So I feed them sunflower oil because it makes me feel better. But my horses that have got problems, like my 28-year-old or my liveries or whatever, what else? My liveries are on salmon oil from the vet basis. But really, salmon oil is amazing. It's got the most amazing mix of omega-3s and omega-6s in it.
So
I don't understand why we want to push it into our horses.
Okay.
I don't have enough knowledge on that one. I don't really know why. But my question is, we can get nice, big, fat, healthy horses. Look at the Mustangs in the States.
Yeah.
Okay, I'm not talking about our Namibians here because those dudes are they lean and fine.
Yeah.
But look at the Mustangs. They don't eat salmon oil. Look how most of those Mustangs look.
Yeah.
Why do they feed on grass? So to me, to stick as close to what the horse eats as possible is for me. Yes, there is oils and grasses. Okay, so let's not beat about it. I like the oils, other than the fact is that I know I get omega-3s and 6s out of them. I like oil because it helps the food move through the gut, which is why horses like Apollo was getting literally a cup of oil 3 times a day.
Yeah.
Not because I felt that he needed that from the omega perspective, but the fact that it actually helps move the food along the gut.
Yeah.
So, and omegas and 3s, he gets that, as a result. But certainly canola oil is the best. And if I'm going to feed any oils, would I feed my dog salmon oil? Absolutely.
Yeah.
But it doesn't ring true why we're throwing things at our horses' guts when it's not natural.
Yeah.
Throw a natural stuff at it. What do? You disrupt the bowel, you stuff the gut health.
Yeah.
So and that's just me.
Yeah.
That's again, as you say, anecdotal.
Yeah.
That's me. But I'm not going to go out there and sell the benefits thereof of all these things because
I think
I can't see I like logic.
Yeah, I think that there's a lot of always research lacking on equestrian products. I think equestrian products are sold on an anecdotal basis. This top rider uses the sheepskin number, and if you use the sheepskin number, you can also win an Olympic gold.
Yep.
No, it is in all honesty, like the signatures on the packaging, and they won an Olympic gold using that. So that's your, and I like research as well, and I think the one big thing is we can always learn. You know what I mean? There's feeding practices that were common, let's say 20 years ago, for example, bran. And then on a hot horse, you'd only feed it bran the week of a competition because it would keep it quieter. But I think as you learn more and educate yourself more, you learn that that's probably not great for its gut health.
No, because the horse became quiet, not because of the bran, became quiet because it didn't have enough nutrition.
Yeah. And then you want to compete it hard and its body has not got enough nutrition to feed its muscles and its gut, and you're going to land up at the end of it in a situation.
Okay, well, that goes back to optimum gut health.
Yeah.
If you fix hindgut acidosis, you reduce colic, you reduce tying up, you reduce laminitis, you reduce, what else did I miss? Mycotoxin poisoning.
Yeah.
And if the whole thing is fix your horse's gut.
Yeah.
Fix it to doing what it should be actually doing.
So I know you said earlier 97% of thoroughbreds had ulcers. So obviously there is, from what I've learned from experience, there is the standard treatment for ulcers with omeprazole. And according to the protocol, the horse has to be reduced in food the night before in order to give the omeprazole in the morning onto an empty gut.
As empty as possible.
Okay.
And this is one, interesting enough, when I sold Althenic, this is one of the things that the vets laughed at me about, is the fact that Althenic needs to be given on an empty stomach.
Yeah.
But my horse never has an empty stomach. So omeprazole needs to be given on an empty stomach. But, it's kind of like, how do you get an empty stomach?
Yeah.
I don't reduce my horse's feed at night.
But you would give it before you give concentrates.
Bingo. So what I would do is my grass horses are invariably the ones, my non-grass horses, my short stem horses are invariably the ones that would get the omeprazole
Yeah.
in the morning. I'd come in the morning, the food that I'd fed at 8 o'clock last night is finished, okay? And I know that the bull lasts the night.
Yeah.
So all they're doing is they literally, I mean, Goose gets 4 kgs in his ball overnight. My other livery gets about 2 kgs at night. So I know that by 4, 5 o'clock in the morning, the horse is now finished eating. If they're not finished, if they don't have food at 4, 5 o'clock in the morning, then I make sure that they do. They only need less than an hour to have an empty stomach to be able to feed anything like Alsanic or omeprazole. You pop it in, go and mix the food, Bob's your uncle.
And then what would your wait period after giving omeprazole be? Like half an hour. And then concentrates.
And then, well, concentrates, depending on what your concentrates, in other words, your cubes.
And then I know a lot of people actually have done, when a horse, for example, has ulcers, that they also treat with Alsonic because it does help the hindgut more than the omeprazole.
No, it doesn't help the hindgut. The ulcers we're talking about now in the stomach.
Okay.
Omeprazole is a PPI, so it actually basically drops the amount of acid that is actually produced.
Okay.
Okay, proton pump inhibitor.
Yes.
It actually reduces the amount of acid that it actually does. Alsanic actually coats the stomach.
Okay.
So the idea with Alsanic is the fact that when you add it into an acidic environment, it actually goes tacky like chewing gum.
Oh, okay.
Bizarrely enough. And
I'd love to know how someone worked that out. I'm just fascinated.
I know. It's the Japanese, doll. It's the Japanese. The Japanese, I believe. But it tends to then almost like line the stomach, but it has this propensity to find where the ulcers actually are.
Okay.
So it actually creates a little bit of a coat to reduce the pain. So Alsanic, does it work in ulcers? Yes, absolutely. But is it as effective as omeprazole? Well, it's never been tested against omeprazole.
Okay.
But it has been tested against cimetidine and ranitidine.
Okay.
And there's no difference in efficacy in the treatment of ulcers.
Yeah.
Okay, except for the fact that you've got to give Alsanic 3 times a day. And when you're feeding 60 mils to a horse 3 times a day, it is not a cheap exercise.
Yeah. But it's a worthwhile one if you can shut down the problem.
You know, if I get into, like, sometimes my 28-year-old, I go in there and Jar says to me, he's pawing. And then my heart sits up here and I go, fuck.
Yeah.
You know, they're already plotting my trip to Honestaput.
Yep.
And then I look at him and I go, yeah, this is not a colic. He's just, again, maybe he's run out of his ball a little earlier. I pop him 60 mils of Alsanic and then he's like, in a half an hour, you can see the horse is more comfortable.
Yeah.
So definitely, it definitely does work in ulcers, but it definitely has a beneficial effect of soothing.
Yeah.
And I know horses don't regurgitate. Not supposed to regurgitate.
Yeah, not supposed to.
But they can. And that's the other advantage that Alsanic has, is Alsanic is the only product that will actually adhere down the esophagus. So if there is any reflux of whatever that you're going to get, it does help that soothing as well. Would I treat with the Alsanic and the horse with active ulcers against either, I can never remember, esomeprazole or omeprazole? I'd still prefer to go the omeprazole route because I think it works quicker, it's easier to actually administer, and there are less feed effects that you need to take into consideration.
Yeah.
But I'm never without a tube of omeprazole or a bottle of Alsanic.
Then, obviously, as far as I know, once you've treated ulcers, they do tend to go away. It's the easiest word I can use here. Would you, just thinking about competition horses, when they're about to approach high stress environments, like, for example, a 3 or 4 day show, trucking down to Plate, trucking to Cape Town, would you treat a little bit as a preventative? Or would it be horse dependent?
I think it would be horse dependent, but if I needed to actually make a call, how much harm are you actually doing if you do give it 2 weeks of a half dose beforehand?
Yeah.
I wouldn't say, oh, my horse is going down in 2 days' time, and then suddenly start giving it omeprazole. I would probably start 2 weeks before giving it a half dose or even a quarter dose.
Yeah.
Just to actually take that edge off. And of course, I'd make sure it had lots of lucerne on the way down.
When in doubt.
When in doubt, when in doubt, give it lucerne. So
then are there any, I mean, obviously we sort of touched on the oils and the gut supplements. Are there any other supplements that you do? And again, it's a very contentious one, is joint supplements, because of the absorption. That you never know. And I mean, for the supplements that I feed, I've gone and done the research into the weight of, for example, the MSM and the chondroitin and the glucosamine in them, that it has some form of efficacy. But I only feed those supplements at night, because I know my children in the paddock do the knock on their feed bowl things, and that tips over. And particularly when you've supplemented, you're like, and there is my retirement fund lying in the grass hither.
I know. Okay, so supplements. Yeah, look, the MSMs, the chondroitins, all of these products have found to be incredibly beneficial. My problem is the fact that they have had the prices rip the hell out of them.
Yeah.
There is no reason for these joint supplements to actually be the price that they're after. That is absolutely ridiculous. These are not new products. These are not new ingredients. Yeah. And I won't actually feed anything that is that kind of price, because I think that's an absolute rip-off.
Yeah.
I must admit, the one product that I also did quite a bit of work up was on the Equiprovet products.
Yeah.
And those suppositories are something else. The equine is something else. Yeah. Sure, the half-life is only about 96 hours.
Yeah.
And not like you that compete at Grand Prix, like I was still at the top of the level when advanced was there was nothing more than advanced in this country. And so when I rode my little thoroughbred against the big warm bloods in the advanced classes, I maintained him on the suppositories.
Yeah.
And if I missed, I used to give him suppositories 2 or 3 times a week. And if I missed a suppository, you could actually feel the difference. The lubrication, the buildup of hyaluronic acid. Yeah. Those products, I did.
I'm a big fan of the suppositories. Obviously, you can't give them during shows, but under SAF regs. But in terms of knowing a horse gets it, but also I think we've all been there, where one's given a horse a suppository and then 5 minutes later watched it manure, and there you are, sans rubber gloves, going, I am not losing my 300 rand. It's every horse owner's worst nightmare, that you watch it pop back out. It's reality. It really is. And you're going to save that.
Oh, no, you don't actually. Do not pass go. Do not go to around 100 rand. Look, I mean, the good supplements around is the PSGAG.
Yeah.
Okay, that has got amazing clinical studies on it. And then obviously the Pentazans. Pentazan is a really, really good product. So if I'm going to go joint supplement, I'm going to go something that, listen, I do use a joint supplement. I buy the cheapest one on the market, because there's no difference buying one that's 300 rand a month compared to the one that's 2,000 rand a month. It's just that branding and marketing
makes a difference.
Makes a huge difference. But
I want a pair of Louis Vuittons, like
like seriously, I want a Tesla Bucky. I mean, a truck. What the hell's that thing called? But we can't all have this. So I'll have a Toyota. But if I was competing at the time, the PSGAG doesn't really show up. There is no reason why. Why can you not use it?
There's a statement on per rectum treatments.
Okay, yeah, I know that, but that's not because of the PSG.
No. So it's not because of that, but it unfortunately falls into that category.
Yeah. So certainly. I mean, I think joint supplements are a good idea, and I think treating your horse in competition like a sportsman, a sports person, sports animal is good. I think you do need to do that. So therefore helping them supplement with things.
Then just to touch base on Pentazan, I've read a research article that I can't think of off the top of my head. I think Vet 360 off that Vet 360 research site, that there's a slight challenge within, I think it's a 24-hour window after the administration of Pentazan, that you run the risk of them not clotting as well.
I must admit, I don't know about that, but
so I normally, if I give Pentazan, I give them the day off afterwards, because there is also some research of the benefit that it helps the healing if they're not actively working.
That makes logic sense.
Yeah.
And despite the fact that I haven't read
Yeah.
the literature, logic works
Yeah.
as well. Yeah, I like logic.
Then anything else? I mean, I came across a horse the other day, never had it before. It had thumps, which is the synchronous diaphragmatic flutter. It's hiccups, essentially, from a lack of calcium. Never in my life experienced
Never
it.
in my life experienced that.
I was sitting on the horse, and he's a stallion, and I started getting these rock sensations, and I did a check just to make sure he wasn't eyeballing the mares, and that's what I was feeling. And it had hiccups.
Well, you want to tell me your horse doesn't reflex?
Yeah. So it's interesting. I mean, I think I've come across a few oddities, but the one oddity I did come across, I did do your testing with the strip. Is there any other testing you'd look at? So one I do want to touch on is fecal egg count. It is a popular test, but obviously they don't cover all the worms.
Yeah, I think there's some strongyles or something that is not covered in that.
Encrusted strongyles, yeah.
Yeah, but you can actually ask for it.
Yeah.
You can look. I mean, I've had my horses on site here for 5.5 years now, and prior to that, where my horses were stable before, they were automatically dewormed every 6 months.
Yeah.
I do fecal egg counts. I'm very bad at doing them, but I maybe do them twice a year.
Yeah.
And I've never had worms at all.
Yeah.
But the question is, you need to ask yourself, why do you not have worms? Why do you have worms?
Yeah. That's the next question.
So, every single afternoon, all the poop
is picked from the
paddocks. Picked from the paddock,
yeah.
Except for on occasion a pile or two.
Yeah.
Because after all, the dung beetles need poop as well.
Exactly.
So, a part and parcel of that. But there's never a modicum of poop anywhere on this plot. So husbandry, so yard management is important. There's nothing worse than walking into a yard where there's like 2 weeks worth of poop in the paddocks.
Yeah. I love overseas because obviously they've got the sort of automated technology. You've got almost poop vacuums that you hook onto a quad bike and you just run around the paddock and vacuum it up as you go. Love the idea.
Well, we now have one of those skids that you can actually attach behind your quad bike and pull.
And it sucks it up.
It picks up all the poop and the molehills and whatever else you want to pick up with it. What can I say? But anyway, look, I think if I could leave my grooms in the stables overnight to pick up the poop as they actually pooped, I would do that.
Listen, I've owned a few grey mares, so I have diligently mucked out during the night every 2 hours because there's something about a grey mare and its attraction to piles of manure.
Yeah.
And no matter how many layers and bandages and everything you have on it, it will find a spot.
So yeah, look, worms are there, but like
management.
It's management, and do your fecal egg counts, and don't worry about over deworming. Don't worry about deworming if fecal egg counts are good. In fact, I was chatting to one of the vets that said you should still really kind of like deworm. I think Honest would look at it as well, like once a year or
in the autumn time normally.
Yeah. But I did that this year. But for 4.5 years, I've never had any worms, except with my youngsters when they came up from Natal. But then that's just that standard sort of youngster thing as well, and what else.
I think also because particularly like I know with some of the youngsters I dealt with, we do the fecal egg count a little more often because they're prone to eating manure as well. You know what I mean? It's a bit of a challenge some days.
Yes. Oh.
Gotta love horses. They'll throw something new. So I think the take-home message is look at what you're feeding your horses. Keep it simple.
Keep it as natural as possible.
And if you want to add something in, do your research.
Yes, please.
So thanks for joining us again, and we hope you enjoyed it. And thank you, Althea, for sharing your wealth of knowledge. It's been great.
I didn't realize I knew that much. Well, it was great fun. Thank you.
Pleasure. We'll catch you next time.